CBC News has learned many provinces are using just a fraction of the millions of rapid COVID-19 tests that they have received from Ottawa. CBC's Power and Politics collected this new data, and you see it there captured on the map. They asked every province how many tests they've received from the federal government and how many they've actually used. PEI has the largest percentage, and even then, it's 25%. Other provinces, including Quebec, Alberta, using less than 1% of their stockpiles. So let's look into why so many of these tests are sitting on shelves. John Northcott has that story today. John?
Good morning, Heather. Some of this may have to do with concerns about false positives or false negatives. Some of it may have to do with either a lack of resources or distraction while trying to put vaccines in arms rather than doing that rapid testing. But the key to understanding some of this is some would argue the irony around the fact that these rapid tests were called for by so many premiers across this country. Let's listen to some of them.
And that's been jumping up and down, screaming for the rapid tests more than I have.
We wouldn't be shy about using any tools that we think might be helpful, in particular when it comes to actual antibody testing.
If we see a highly credible regulator of medications in a pure jurisdiction like the European Union that has approved a test, we should pursue that. We should not wait for Health Canada to catch up.
So that's an array of premiers taken really since April right across the country. As they say, initial demands made in April, but as recently as last fall, similar demands made by premiers from across this country. Worth noting in that Ontario, 18.5%. So they are ahead of the pack, although not leading. PEI leading with 25%. Still waiting for the numbers from Saskatchewan, Premier Moe's province. But the province of Alberta, 0.89%. So really much less than 1% used in all of this. So why would there be a reason to have these tests if there is or not urgency? That's the debate around this. Let's listen to Dr. Michael Gardam.
You can imagine a setting whereby you are regularly testing people with these rapid tests, which would give people, a high degree of confidence that people coming into the workplace actually aren't, actually spreading COVID-19. They're not perfect, and that's probably the big reason why people have not used them. But, the modeling studies show they have a very valuable role.
So not perfect, but still the implication there, in fact, Michael Gardam went on to say that, Dr. Gardam went on to say that, while not perfect, they could point to industries or sectors of the society that were or were not a potential threat in terms of spikes, in terms of considerable caseload, and decisions might have been more accurately made around the shutting down of various regions and sectors of the economy. Heather?
What are officials saying, John, and now that this is coming to the fore, that there are these millions of tests on shelves across the country?
Yeah, some saying, as we've heard the Premier of British Columbia, although again, he's about 18%, saying that there were some concerns over that false positive, false negatives aspects to this. We know that, for example, the Health Minister of the province of Alberta had said on Tuesday that they had a number of pilot programs targeting particular sectors, one particular company, Suncor, in terms of being able to gather data moving forward. But still, again, that very low number. And the Prime Minister earlier in the week urging people to take advantage of these rapid tests.
Our government has sent 19.6 million rapid tests to the provinces and territories, with more on the way. Tests must be deployed. They can't be allowed to expire.
That's the advice from the Prime Minister. We have seen this, as I say, with the initial requests from various premiers across the country. Probably get a little more reaction as the day unfolds. Heather?
John, thank you very much.